it's Dr. Karen, and I'm a distributor with LifeWave, a medical doctor, holistic physician. And in today's tutorial, I want to show you a couple of different ways that you can patch for hip pain. One of the things that you need to know about hip pain is that typical hip joint pain is actually groin pain. Now, it doesn't mean you can't have pain here, but hip joint pain is often groin pain. So if you just have pain back here, it may or may not be your hip joint. So just don't assume that it's arthritis or anything like that. So we're not going to patch for any disease names, okay? But we are going to patch for pain relief. And so what you want to do is just try the different protocols and see which one is best for you. So the first one we're going to do is the clock protocol, and that is the classic one that is in the brochure for the LifeWave patches. So that uses IceWave patches. Now, I have a little tip for you. I do find that there's a percentage of people that do not have a good balanced nervous system. And if you balance the nervous system at the same time you're pain patching, I find that you get even better results. So it's a little bit of a tweak on the traditional clock technique. So what do we use to balance the brain or balance the nervous system? Well, it's actually the Eon Patch. Now this is optional, but I just want to show you in practice what we often do when we are with people and we patch for pain. So the Eon Patch is the one in the blue package, and that's a single light patch. And for brain balancing, we often just use behind the ear point. And what you want to do is make sure you hydrate with water. So let me go and hydrate. Okay, so here's my water bottle. We're going to hydrate. Now, oftentimes you want to hydrate for 16 ounces or so before you do the patching for best results. So we've got the Eon Patch behind the right ear, and then we're going to patch the clock protocol, which is in the brochure. So for IceWave, you have a white and a tan, and classically you would put the tan first over the area of pain. So now you could have pain in different parts of your hip, all right? But what we're going to do is just going to show you if you have pain on the side of the hip, for example. Now you can extrapolate for the different parts of the hip as well. So if I got pain on the side of my hip, I'm going to put the tan patch on the hip, okay? And of course, before you do that, just make sure you quantify your pain somewhat. So if I'm at a, say, 8 out of 10 in pain with movement, okay, with and without movement, you should quantify it, then you would want at least 50% decrease with the patching, and it's usually very quick if you get the right spot. So tan over the pain spot, and then white, you're just going to put a couple inches above, right? So wait 10 to 15 seconds. We often like to do the sing the Jeopardy song during this. Okay, I was off tune there. Anyway, so after we do that, then you go ahead, retest. If there's no change or not enough change, you're going to take the white patch and you're going to move it at the 3 o'clock position. Now, this is very interesting because you can put it right over, in this case, the groin, where we said that's actually hip joint. But, I'm going to another tip, the iliacus muscle that's inside the ilium here is often strained or too tight or unhappy, causing hip pain. So you can actually make that 3 o'clock a little higher. So here's the tip of my hip bone. So you can actually make that a little higher so that it's shooting energy through this area. Again, that's about 10 seconds, right? So again, you're gonna move around, see how that feels. Now that doesn't increase, or sorry, decrease your pain or increase your mobility. You're gonna put it at the 6 o'clock. Now in this case, it's probably more than 3 inches, but it doesn't really matter. This can be all the way down your leg for 6 o'clock if you'd like. And sometimes people think the further away it is, the better it works. So you can try different things. Again, after 10 seconds, move around, see how that works. Actually, I feel a difference on this one. Okay, note to self. All right, and then your 9 o'clock one might be, here. Now there is a muscle that goes across here called the Piriformis, and that sometimes can squish the sciatic nerve, causing pain down the leg and down the back of the hip and down to the knee. So you can actually poke around here and see, there's usually a muscle belly here. You could actually put it right on the muscle belly if you'd like so. Okay? Or, okay, so that's right more or less on the piriformis. Or there's a hip point in acupuncture called gallbladder 30, and that's kind of where the dimple is. So you can actually even put your 9 o'clock in this dimple area. There it is. I can do a little bit of a hip lift, and I can feel the dimple area. So then after the 10 to 15 seconds, you're going to move around. Actually, my hip kind of likes that one. Okay, so you have a variety. Now, say this is your best placement so far. What you can do is tweak it a little higher, wait 10 seconds, go down, nope, didn't like that one, okay? Go a little lower, wait 10 seconds, that was a little better, so you can kind of go further in, further out, for example, wait 10 seconds, okay? So that's what you can do. So that is the clock technique. Now, if you happen to get worse pain, okay, you put the tan on the pain and you move right, and then you get worse pain, oftentimes it gives you a hint. It means the energy wants to go the opposite direction. So say you're here and you go, oh, that makes it worse. You know what you do? You swap the colors. And that should make it better, okay? Now, if you get out of pain or almost all out of pain with the clock technique, one of the things you can do, if you're like, well, I wonder if I really need the Eon. Now, the Eon's for brain balancing, but it's also for anti-inflammatory. But you may or may not need it for the symptom of pain. So you can always, after you get the pain relief, say you got, from 8 to a 2 out of 10, you can take the Eon off, I'll just put it aside, and just wait a few minutes, and retest your hip, right? And if you're good to go and the pain relief is still there, then you probably don't really need the Eon there for the purpose of pain relief. Okay. So that is protocol number 1. Now the second protocol I'm going to show you is actually, it's a triangle protocol, okay? So it's a triangle protocol, and we're actually going to be using more than one type of patch. So I have here some more tape because you want to experiment and you want to have enough tape to so you don't have to take the little sticker backings off if you don't need to, okay? So we're going to start with our ice wave. Put some more tape back here. Where's the other one? There we go, ice wave. Okay, so we got our ice wave, right? Now, one of the things that often happens is, I mentioned before, is that iliacus muscle gets really tight. So the tan patch is a negatively charged patch, and it's more for, dispersing energy. So in Chinese medicine, if something is too tight, you want to disperse the energy. So one of the things you can try is if you put your hand over this, this hip bone here, okay, and where that comes around, there's like a little dip right in here. You can put your tan patch in here, okay. Now, what else do we use for the triangle? Well, if you want to get fancy, we're going to get fancy today, you can actually put an Eon patch and an X39 to make a triangle. So where do you make the triangle? Well, you got your tan patch in the front. Now, let's say, here's the Eon. You can do the Eon back here, where either you feel pain, tightness, whatever it is, okay? So now you've got that kind of sandwiching and the energy's flowing through these two patches. The X39, you can actually put in between. Okay, so now we've actually got a pyramid or triangle. There's shooting through and it's going this way. And then you say, well, Dr. Karen, I have another white patch. I have another ice wave. What do we do with that? Well, a couple of options. One of the simplest options is that wherever you put the tan patch, you can actually put the white on the opposite side, like so. Okay? Or you could put it mirroring the side one, or you could put mirroring the back one. So let's see if I can get that shown here. Okay, so and this is not carved in stone, so you gotta play. So say I decide, well, I'll just go do this one here, okay, because my other iliacus probably could use some help. All right, so if I have one on each side, all right? Then again, you want to test your range of motion and see if that helps with the pain. Again, you want to make sure you drink enough water, right, to hydrate your cells to do that. Now, say you feel no difference using this protocol. Guess what? This triangle protocol, you can swap the patches. Okay, so for example, I'm going to go ahead and do a little sit. Okay, I feel some tightness back here. So I'm actually going to put the tan one back here, and then I'm going to put the Eon in the front. Wait 10 to 15 seconds. Okay, maybe it's more like 5 seconds, but we're going to go ahead and do that again. Oh, that's a little better. Okay, so I like that one a little better. So now let's go ahead and let's swap these two. I'm going to swap and put the Eon here, and then I'm just going to put the X39 over that iliacus part. I know this one hasn't changed. I'm just doing one thing at a time, okay? Again, wait 10 to 15 seconds. Go ahead and stress. Okay, not as good, not as good. So definitely the Eon like to be more further front here. Now you can say, well, it wasn't perfect. Not all the pain was completely gone. You can take your white patch for the the IceWave, and you could play around with that one. And we're just gonna leave the X39 off for now. Okay, so we just have a triangle here. And we're gonna go ahead and sit. Not bad actually. That was pretty good, but not as good as this one. So I'm gonna put the X39 back here. You see how I'm playing? So it's very forgiving, these patches. It's just where the energy wants to go. Yeah, definitely. That one's definitely better. All right, and this one, let's see. You know, I'm actually gonna put it in on the back here because I've got the tan IceWave there. Okay, and we're gonna try sitting. That's actually pretty good. Yeah, I have actually greater range of motion like that. I still feel a little discomfort here, but not too bad. So those are the ways that you can play around with the patches. Now, in the next part of this video, I'm actually going to show you some of the manual therapies that I do to release the trigger points related to this, which may also help you in addition to patching for the pain. So I'll see you on the next part of the video. Hey, it's me, Dr. Karen, and in this part of the video, I'm going to show you some of the other tools that I use to help release tight muscles. And I'm an athlete and a figure skater, so I will work my hip flexors a lot, including the psoas muscle and the iliacus. Now, the iliacus is on the inside of the ilium, and a lot of people ignore it. I highly recommend Christine Koth's book called Tight Hip Twisted Core. Excellent, excellent book to understand more about the iliacus. So I'm going to show you one of the really awesome, probably the best tool to release the iliacus. So it's called the hip hook, and it looks like this. Okay, very, very sturdy. I'll put a link near this video where you can check it out as well as a coupon code. And this is going to go right into your iliacus muscle. So if this is the nipple line, you go all the way down past the hip crest and right inside your hip bone here, okay? You start there and you put it flat and then you lie on it. Yep, you lie on it there. And now I already released mine today a little bit, but if you don't feel anything, you can actually twist your hips a little bit, just a tad, back and forth to find the achy spot. Yes, you were actually looking for a pain spot. You're looking for an achy spot. That's like called a trigger point, where it pushes on the muscle and it gives you an ache, sometimes down the leg. And what you want to do is breathe in and out through your nose through that. So I'm going to move it down a little bit. Okay, and yep, I can feel, ooh, right there, right? So right there, I do feel it. See if I can move the video camera a little further down here. So I've got it in the iliacus here, putting my weight on it. Okay, now some people, it is like so exquisitely tight, they can't even put their full weight on it, but I'm able to since I'm practiced. So as you're doing this, I'm breathing
and I'm looking for the ache. So I'm just going to twist my hip a little bit. There. I can feel the ache right there. Now, for advanced, you can actually use this lever, and you can actually put some weight on it with your hand, just to get it a little deeper and a slightly different angle. Yep. And you want to stay here about 30 seconds to a minute where you feel the ache, and you should actually feel a shift. It either feels less achy or it feels like you're sinking into it more, so it's releasing. And you know, then you kind of go up and down and figure out, you know, where it still needs to release. Now, I already released this quite a bit, so I'm not feeling it as much as before. And I worked out this morning. So that's the hip hook, which pretty much you can try and buy any other product, but this is the only one that gets that iliacus perfectly. So I highly recommend it. Okay. Now, after you release the front, oftentimes you want to release the back too. Ooh, I just got deeper. You just feel that. Ooh. So it's actually some achiness is going down the thigh. So if you just follow the instructions on the hip hook, it'll be very safe. You're not going to be pushing on nerves or you know, blood vessels or anything like that. Just got to remember to breathe. Okay, so let me show you the other one. So for the hip, you're actually going to use like a lacrosse ball. I've actually got these little cool things, which are like, this one doesn't roll around, but most people, you know, you can get these on Amazon or whatever. So you're actually going to go and put it on your hip, or your gluteus, medius in this case, and you're going to roll around a little bit until you find an achy spot. There it is. And then you're going to breathe. And you don't have to have your head up, but there, now you can see me. So you can put your leg down if you'd like. I'm using the other leg up just to stabilize that a little bit. So I can twist and then find the achy spot. Okay, so it stopped being as achy. So I am going to move it up a little bit and then relax back down. Okay, woo, that's more achy. Okay, that's a good spot. And remember to breathe in and out through your nose. You can also use your imagination to imagine the muscle relaxing. So the front gets tight, the back gets tight. Very, very common issue. So you could play around, play around with this. This is a great way to release that piriformis muscle, so that's a little lower. And I don't really have a piriformis issue, but you could even raise your leg if you're more advanced like this, just to put a little bit more weight on there. Again, this is very, very safe to do. If you feel like, oh, there's like lightning strikes down your leg, then you're probably on the sciatic nerve and there's a pinch there. So you want to go on the muscles around that so you don't get that feeling. So if it's achy, that's good. If it feels like lightning or pinch, move to a different spot. Okay. So, and it's not about moving it and massaging it. It's really about staying still and releasing that spot. And when you feel less pain, then you can move it. Okay. Now, the nice thing about this one is that you can kind of hit a couple of spots at the same time. It's less intense. So you can, for example, there you go. I'm kind of using the side. Ooh, there's a good spot right there. Oh, yeah. Achy. This is good. Now, can you do this with your patches on? Absolutely. I'm just showing you separately because you wouldn't be able to see my patches on anyway if I put it on my skin. And the other spot you may want to release is called the TFL, the tensor fascia lata, right here. So, and that's pretty intense. So this is nice because it doesn't roll away and it's a little less high because I have a dip in between. So I'll go ahead and go on the side and then find that muscle. There it is. Okay. And kind of let that weight push on that trigger point.
Now I'm not feeling it as much, okay? So I'm just gonna go to the single ball. Now it's gonna have all the weight on that one, and I can go a little deeper. Oh yeah, there it is. So it's slightly more in front that I feel the trigger point. And you can look on an anatomy book and actually see where the TFL is, the tensor fascia lata. It's the muscle. I'm not talking about the IT band. It's above that. Yeah, and so these are really, really great things to release manually. And then the patches can really help you with the symptoms of pain and increase the chi and blood flow in the area. And that will improve it. So both is good. And then last but not least, I'm going to show you a stretch, a hip stretch that I love to do. And this one you probably have seen before. Let's see if I can get my body in the right position here. Is you make a 4 with your leg. Let's see if I can go a little further here. So you make a 4, okay, like this. And then you're going to lift the bottom. And that helps stretch at the back. And again, you're breathing. And if you want it more advanced, you can actually use your elbow to kind of brace the right here. So as you pull it in, you're bracing that out. And remember, you're going to do it on both sides. Okay, this side is more flexible than the left side at the moment. And then last but not least, a little bit more advanced is putting your foot up. Now, of course, I'm pretty flexible here, so you might be here, okay. But you may want to sit on a little pad so that you're not like this, okay. And let's see if I can show you from the side here. So I'm going to sit up as tall as possible here, and then kind of pike forward here. And this may be all you need. So I'm not rounding my back, okay, because then it's a back stretch. So as a hip stretch, I'm going to keep my back straight, and I'm going to lean forward. Now, I'm a medical doctor, but I'm not an athletic trainer. So, you know, this may not be perfect, but it's going to be safe for you to do. And if you think, oh my gosh, that's too hard, then you can actually just go into regular cross leg, sorry for the noise, and lean forward. Now, I don't get anything there, so. Again, switch sides. I got a water pump going. I'm doing laundry. And in this case, what I'm doing on this side is keeping the back straight, going forward, and then once I've hit the max, then I'll go ahead and curl to get a little bit more range of motion. Breathe. So we'll switch back. This is my tighter side. So I'll show you from this angle. So I'm gonna go back straight, and then that's the limit. Now from this point, then I'll curl forward. And breathe. Woo, this is a good one. Yeah, so that is how you can release your iliacus, your glutes, your tensor fascia lata, and that may help you with hip-related issues. You know, go slow. This may or may not be appropriate for you, so use your discernment. You can even check with your physical therapist or your medical doctor just to make it safe for you, especially if you have been diagnosed with some sort of arthritis or hip pain. Some of these exercises may or may not be best for you. What I can tell you though is that that hip hook, okay, is actually very, very safe. And when following the instructions, even if you have some arthritis or something in your hip, I think this would be really, really helpful to help you release that iliacus muscle, because it is an overused and under-relaxed muscle, and this is a brilliant device to help you. And I will post the link to this device near this video, as well as a coupon code that I got for you. So I'm loving it, and hope you do as well. So if you are watching this video, you know, post a comment on the you know, below this video, and just give me some feedback on, is this helpful? You know, what else do you want to see? Try it out. Let me know how it goes. yeah, if you want me to clarify anything with what we just discussed, let me know. So please comment in the video, and if you're watching this on YouTube, just hit subscribe so you can get some other LifeWave micro training as well. All right, until next time, bye for now.